So, very happy to be with you today for Paltop Academy. I will try to share my passion about lasers with you, and this webinar is about applications of lasers in implantology. So, just a little presentation. I'm from Lyon, working in Lyon since nearly 30 years and sharing my time between France and Israel. I started by using diode lasers, and I started 10 years ago when classical methodology and protocols in periodontology didn't satisfy me completely. And I started with diode lasers, and you can see that when we talk about lasers, it's a very large field of application and large field of different lasers. You can see here an helium neon 660, a diode laser with 3 wavelengths, diode laser, laser NDIAP, which is a French laser, normal manufactured, erbium chromium, erbium YAG, Israeli laser. So many lasers are used, and each laser is very specific. So just today I did a summary. I used a lot of lasers, and I'm working a lot with this laser, which is an erbium YAG, and combined with ND-YAG, which is a vascular laser. And I love to work with this laser because we have 5 time impulses we can choose, and it's very, very important. So with a lot of aesthetic handpieces, which allow me to do many things. And I have a second laser, which is a diode laser, 3 wavelength, and with these 2 lasers, we can say that we can do nearly everything. So lasers are only tools. It's nothing magical, but they are tools, and these tools are very interesting for our patients because the patients today are searching for aesthetic, simplified treatments, and without any pain. And of course, it's something which is very important for them. And with lasers, you work always reducing pain, reducing inflammation. So these different lasers you can see here are emitting in 1 wavelength, very, very precise wavelength. This is the difference with visible light. Here you have from blue to red many wavelengths, and this is the difference from natural light and lasers. Lasers, you make an irradiation which is very precise. For example, here ND-YAG, which is 1064, and it's very precise, and it depends about the medium you have inside the laser, which is here a YAG, erbium, and neodymium YAG, and this will give the specificity of the wavelength. What is very important when you have to choose a laser, and for example we'll see for implantology, is that your laser has to be chosen depending on which target tissue you will work. For example, if I work in extraction, here I will search for being absorbed in hemoglobin. If I search to work on the bone, for example, gingival tissue, I will search to be absorbed in the water. And sometimes you have a combination here, good combination of good absorption for some lasers. So you can see that diodes here are well absorbed in water, hemoglobin, melanin, and here erbiums are very well absorbed in water, and less wavelengths, low wavelengths, will be well absorbed in hemoglobin and melanin. So this is very important to know this picture. What is happening when you make an irradiation, for example on the bone, You will have a little reflection sometimes, you will have penetration. This penetration is depending on the structure of the tissue. Of course, it's very different inside. You have vessels, you have nerves, you have cells, you have collagen, fibroblasts. So you will have scattering, and sometimes phosphorescence, fluorescence, transmission. So when you make a radiation, the absorption depends of the tissue. But you can say that we have two families of lasers. One deep penetrating lasers here, which will penetrate in the tissue, and one family which is absorbed. And when the laser is absorbed, it's more easy to start, perhaps, because what you see is what you do. But here, when there is penetrating lasers, what you see here is not the effect you have inside the tissue. So it's perhaps more dangerous here to have to use this kind of lasers, but lasers are a real specialty, and you have to follow courses and so on, and you have to know to have the knowledge. So here, these lasers are very interesting because they penetrate the tissue, and you can have all the values about photobiomodulation, decontamination inside the tissue, and so on. And here you will have all the effects, superficial effects. And you can see here that you have a laser working inside the tissue, penetration of the light, and here a laser which is absorbed and which is working on superficial parts. So we will see the different effects of the lasers. The first one is a thermal effect. First of all, it's something very interesting. More and more I'm working on thermal effects, and it's very, very interesting. And it's principally diodes laser working on this effect. Then thermomechanical, we'll see. With the thermal effect, you have a mechanical effect too, which is an effect of cutting, vaporization, decontamination inside the tissue, very, very important. Photoacoustic, which is used in endodontics, but we can use now in a socket, we can use in a pocket, we can use in peri-implantitis, so very interesting effect too. Vaporization with erbioms, which is vaporization of tissue, vaporization of the bone, so interesting in implantology. Biostimulation, very interesting in implantology too. So when we talk about thermal effects, we have to make a different level of thermal effect. First of all is hyperthermia, which is, you see here, they say that it's rarely used in practice, but I would say that it will be more and more, and we'll see in a few videos. So you make a little rise of temperature, and it will give you better vascularization. The second effect is the coagulation, which is obtained between 50 and 100 degrees. You can see and think now that when we talk about coagulation, it's not one temperature which is obtained. For example, in the socket for the clot, you can make different kind of coagulations. Volatilization, which is induced above 100 degrees. This is how works an erbium laser. So you see, when we talk about thermal effects, we can have difference. We will see that in implantology, sometimes we just have to make an extraction. So from the start, how to work with lasers for the first part, just to have a better result with lasers, and to have better results for the second time in implantology. So I published about a protocol which is laser alveolar protocol. Interesting because you can see here very often we lack of gingival tissue, fixed gingival tissue, we have infection, and we can imagine that here we will have a bad situation after extraction. We make the protocol, which is a thermal protocol, and we will have always between 2 and 5 days a very good cicatrization with vascularization, fibrin, link from the clot to the gingival tissue. So all this is very interesting for implantology in the second time. Just here, I just show you a case of extraction. It will be a patient with implants, and perhaps it will be, this patient will be implanted with P implant or advanced implant. In a second time, here we lack of gingival tissue. So you can see that first of all, the work of erbium laser will be to clean the socket, to work on the border of the gingival tissue, just here, to have a better link with the clot, to take out the granulation tissue. And it takes time. You can see that it takes time. It gives the first vascularization, of course, but it's not enough. The aim is to clean all this. We put 2 temporary implants, and here we use a 635 nanometer laser, which is very interesting for vasodilatation. So we work, you see the penetration, deep penetrating laser, very low thermal effect. We can say that we work in hyperthermia here only, not coagulation. And here an NDIAG, which is a vascular laser, which is working, raising up the temperature and making a thermal effect with a first coagulation. So you can see here with a thermal effect more important on the surface. And here, even around the temporary implants, we can work with this thermal effect, which is controlled. And here, the lack of gingival tissue, we close the socket. Here I use a handpiece, which is a dermatologic handpiece. And with the settings of dermatology, I use it on the gingival tissue because it produces much more fibrin production. It enhances a better healing, you will see. Thermal effect very well controlled, very low intensity in time. Here everything is fixed. And you will see at 48 hours the result. Result at 48 hours, you can see here that we don't lack of gingival tissue, even if there was a recession. You can see the link with the implants. You can see the lack of inflammation. You can see the fibrin, the good vascularization here. So this is interesting to use lasers in extractions. If we can't put the implant because we lack of primary stability, we can make a graft, and here a patient with infection. Normally, if we don't have lasers, when there are big infections, it's not always good. But with lasers, we can make a sure and predictable technique with predictable results. And we decide here, you can see here we don't have the primary stability, so we make extraction, decontamination, and pre-implantation graft. Here there is a lack of bone. We know that for aesthetic we will have a challenge, and the patient doesn't want something complicated. So you can see the acute infection here. We decide to make an incision here just to keep the papilla, because if we make a flap here, we know that we will lose a lot. And this is how the surgery is done. You can see here. So decontamination with curettes. We take off, it's a mechanical ablation of the tissue. The phenothiazine chloride, which is methylene blue with 660, and after we use the erbium YAG, and the erbium YAG will clean superficially the bone. We take off with precaution a lot of care the fibrous tissue. And we, of course, we work with optics. And this is a good way to work. We take time. When everything is clean, you can see here that even if we work on water, there is a vaporization, which is a good way to make a second decontamination. After, we will put the material, which is allograft bone with PRF, ePRF. This is the protocol of Joseph Choucroul. ePRF with alloplastic bone. We just go further, the bone graft with the growth factors of the patient. We make again a wall here, and we will put some PRF membranes to cover the graft. Okay, so let's go further. Here we make free flap with incision in the tissue, and just after I will do it outside, just here, to make a second, better free flap, and not to have too much inflammation, only using the partial thickness flap inside. So we just finish like this. 4.5 months after, we can see here there is the reconstruction, corticalization. Here. We can see the healing and the final result. A few things here. The challenge, aesthetic challenge, it was difficult not to lose a lot because there was no papilla here supported by bone. So, but we don't have any infection again after a few months, and you can see the reconstruction without inflammation. So if we could have insert the implant on the same day, I would have done it, because the most important is that the protocol here of decontamination is sure and predictable. So it was the decontamination effect, and here we have biomodulation. Biomodulation is, you can see here, it's a case of hair defect on the thickness, and the patient will have the insertion of an implant with a lot of work of lasers with biostimulation. So we can do without laser, but we prepare the sites. It will be much better. In this case, we insert the implant. We can work inside the alveolar preparation with biomodulation. We take some parietal graft connective tissue. Let's go on. We will put the graft on the buccal part, and we will put some material. So we can see here insertion of material here, and the bone was prepared with the erbium YAG to do some little holes in the bone and to make a better blood supply. So it can be done with a burr, but it can be easily done with the erbium YAG. Let's go. Closing. 2 weeks later, so here the defect was, is absent. So for biomodulation, I use a lot the helium neon laser, which is no thermal effect, and diode laser, and also the ND YAG. And for this, I love to work with a flat top handpiece. This flat top handpiece avoid the Gaussian effect. We have regular application here with the same energy, and if you work at 10 centimeters or 1 meter, you will have the same energy on the tissue. So very good to have a general handpiece for the NDIAC, which gives very good biomodulation. I'm using 60 joules per centimetre carré for this biomodulation. So how work the mechanism of low-level laser therapy? It's working on the photoreceptors. The light is working like this, but lasers too. The lasers, the irradiation will touch the photoreceptors on the membrane, inside the tissue, inside the cell, and it will be responsible for cellular response to the light. Here, just a summary of what can happen. Action here on oxide nitric, which is very important mediator outside for vascularization, for vascular reactions. A lot of action on the receptors on the mitochondria, which enhance reactive oxygen species, and a lot of reaction here of mediators working again on the nucleus. Production of ATP, and you can see here the effects: gene transcription, cell proliferation, growth factors production. This is very, very important to make a biomodulation in implantology, and that's why I use it a lot. Here, the effects on the vascular tissue, very important with proliferation of the cells and neoangiogenesis. The mechanism is very well known, action on receptors of VEGF, and I could tell you if you want after. So this energy is very important, and here a study showing the effects of different wavelengths on mucositis, but you will be able to find so many articles in bibliography. Decontamination, APDT. APDT is antimicrobial photodynamic therapy, and this is a way of using the light on a dye which will be deposited on the tissue, and this dye will fix the bacteria and microbial, and it will, when it's activated by the light, it creates lethal oxidation. It's interesting in implantology because if you do classical implantology extraction waiting for 2 months, 3 months, it's sometimes you will even have some bacteria. We can say it's safe, but sometimes studies show that you can still have some bacteria after a few months. So when you make extraction immediate implantation, the percentage of failure is more important, and it would be due to the infection. So if we can add a protocol of decontamination, it's very, very interesting. Cases. We can see here a case we will see of this patient had an implant and a graft the same way. Extraction, decontamination, and there was a graft taking some punch and tissue in the posterior part. Here the erbium, which is cleaning the socket, taking off the granulation tissue, as you can see here, to prepare the site to receive the graft. So you can see high temperature, 100 degrees, to make the vaporization of the water. So you can imagine that after a few minutes, this is a first decontamination. It's not enough with an erbium, you have to use a deep penetrating laser to be safe and to be predictable. So in the second way, we will use here a product, which is a dye and which is toluidine blue. This toluidine blue will fix the bacteria, and when you make application of the light, as you will see, you will make a deep penetrating decontamination. Here it's 635 nanometers with a diode emission, and you can see the power of the light entering in the tissue, making this big decontamination. But in the same way, it's making a good biomodulation. So interesting to use this. Light is so important for us in life. We need it to live, and we need it for medicine. So we will go further, we take some gingival tissue and bone in a pot, in the back pot. So let's see just after here. Okay, we put the grafts inside the socket. We make the suture on the gingival tissue. Everything has been prepared here, decontaminated. We make the suture and the biomodulation again. Biomodulation on the two sides, donor and receptor. And here I make a coagulation on the site giving the graft to have a good healing. And here, this is a flapless insertion of implant. So we make the preparation with the erbium. I like to do it for flapless just to make the gingival preparation and with a good emergence profile. So we can choose exactly where we will put the implant with good precision. Take off the gingival tissue. And don't forget that each time you work with a laser, you make a very good decontamination of the site. Even if it's clean, here you make this preparation and it's decontaminated in the same way superficially, it's decontaminated. So after we'll drill to prepare the bone. Here, insertion of Paltop 3.75 advanced implant. And biomodulation. Another case here with a big infection, and we can't put the implant, but you can see here that there is a big infection here, very large, and we need to put the material to be sure about the contamination. You can see here. And we have all the walls, but we use the NDYAG, we use thermal effect, we use APDT, we use biomodulation, we use the bone graft with good vascularization with lasers. Biomodulation, we put the implant in the second time, 3 months after, 4 months after, yes, 4 months. Biomodulation again, a connective graft, and the results with preparation of the profile of the healing screw. And here, another case with a challenge, aesthetic challenge. Here, no fixed gingival tissue here. Big mobility, terminal mobility. So here we want to be sure about the decontamination. We work in an uninfected site. We work with a lot of granulation tissue. We want to win gingival tissue, and we want to make everything in the same way, in the same time. So I need my lasers. I need a deep penetrating laser. I need an erbium YAG, and that's why we just worked in this way. As you can see, extraction, not difficult. lot of granulation tissue, a lot of granulation tissue. So it takes time, but I always say that I'm not here to win time. I prefer to be sure, and I prefer to work on biology than to work in a mechanical way and to take risks of contamination of the implant of the or of the material. For me, biology is more important than time, so it takes me perhaps between 7 and 10 minutes of cleaning with the erbium YAG, but I know that the site will be cleaned, so this is a superficial action of laser, and after we will put the implant. Let's go with the material, and always the bone graft with EPRF. Everything has been decontaminated. Here we put some PRF membrane around the temporary abutment, and there is constriction, the suture, biomodulation. So let's see the results. Here it was at the beginning, and here you can see with the temporary crown. And I was not so satisfied about the work of the reference for the final crown, but if we don't look at the crown, because for me it's not good, but for aesthetic and even for the profile. But here we can see that we won in the height, and we have very good quality. We don't have any problem here of fixed gingival tissue. So lasers, I think, helped us to have this result. Another case, working a little differently with this extraction of this incisive. And here we have a little preparation with diode for the frenulum to have a better hair situation. Granulation tissue is vaporized with the erbium YAG here, and we can see that we have a lot because it was big mobility of this teeth. Decontamination here will be done with peroxide hydrogen and with diode laser, which is not APDT but different mechanism, but very efficient. I use it since 10 years, very efficient for decontamination. Here it's a 660 nanometer, which is an helium neon, very good for biomodulation and for decontamination, but here it's without the dye, it's only biomodulation. The graft, EPRF, membranes, very often, always. And here you can see the close, the frenulum. So decontamination is very interesting, but lasers are very interesting the second time of implantology, as we will see. Here, when we put the healing screw, we make an incision which is little delayed in the palatal part, and to go up quantity of gingival tissue here. And I work here with a little thermal effect on the crestal part, just to have a better result. So this is very interesting to work with lasers for the second time. As you can see here, it's an old case, but interesting to see that we can work without any anesthesia. This is an erbium chromium, and with a special setting you can work with vaporization without any pain, without any bleeding, so you can sculpt the gingival profile of the gingival tissue. And this is very interesting to work with lasers for this session. You can see how it's easy. This is an erbium chromium, which is little more thermal than the erbium YAG. That's why for the soft tissue we have a better way of working. way of working without any bleeding. So it's an old case, and you can see here the gingival tissue is very clean. Here it's a case of a patient here on the buccal part. We did a big reconstruction here on the thickness. So as we did a big reconstruction, there was the gingival free tissue which was sutured on the crestal part, so here we have to make a modification. And it's done in the second time, and it's done with the lasers. I work with the Absorption YAG and the YAG or diode for the hemostasis here, little suture. And in this case, you will win with the gingival tissue, as you can see, very easily. In 8 days, it will be done. So it's very, very, very important to use the lasers for the second time, and really it's very, very interesting. Here you have a case which is I will go further. Incision, it's not so interesting, but when I put the heating screws, I just make a blood supply here with hyperthermal, little thermal effect, and to make a good preparation for the graft, little graft, which is a sponge. And for this sponge, I want to have a good blood support. So the lasers are helping me a lot. It's very, very important. Here you can see that we have a good bleeding. And look, the way of working here is to make this little suture, we can say, with the thermal effect on the material. Here, let's go, and you can see here the healing, which is very good at 8 days, and we win for gingival tissue here, fixed gingival tissue. The last case is a case of a gingival graft with a preparation of the laser, and you can see the vaporization is down. You can see that you can do what you want with the laser, like we would do with a blade. It's a little different, but the thermal effect is interesting for the biology, you will see. Preparations, not very long. We will take the graft, and when we put the graft, we see that we have to prepare again, so we can take the laser again and raise the site for the height. I will work on a thermal effect finally in the apical part. You can see here for the blood supply, and to have a good vascularization, and to have fibrin coming in the days just following the surgery. So here this is very, very important. The graft will be sutured. Let's go. Biomodulation with the flat top handpiece, you can see here. It's homogeneous irradiation, even if you are 5 centimeters, 10, 50, it's the same irradiation, so very good. You don't lose any power or energy. And this is the healing at 8 days. So we can say that lasers were interesting in implantology, as they are interesting in periodontology and for a lot of things. For, I would say, 3 things: for the thermal effect, for extraction, for the thermal effect, even around implants. We could talk about this. What we are afraid is to have a big elevation and long elevation of temperature, but very short, is used in dermatology and it's very good for implants. Second effect is the decontamination with APDT, with erbium YAG, which is making a photoacoustic effect on the socket. And the last effect is the biomodulation. So I hope this was not confusing, because it's very difficult to make something in 3 quarters about lasers. It takes days and days to explain it. And but perhaps some of you are using lasers. So I just stay now for questions if you have. Thanks a lot for your attention.